I always knew that I wanted to have a baby one day and just thought it would all be fine. Luckily, a long time ago now, a lovely nurse helped me understand that I needed to look after my health then if I wanted to be a mum in the future. When I was 19, I went to my GP surgery to talk about contraception with the practice nurse Mark. After checking up on my general health, he explained that being overweight and smoking could affect having a healthy pregnancy in the future. He also explained that I needed to make changes sooner rather than later. Mark gave me some helpful tips on how to eat more healthily and be more active, and talked to me about local stop smoking services. When Dan and I decided to try for children, I made an appointment to have my contraception device removed. Mark said well done for being a healthier weight, and I told him it was thanks to the Couch to 5K programme. He told me to keep up the good work, as maintaining a healthy weight through pregnancy and parenthood isn't easy. Mark also reminded me that smoking can significantly affect having a healthy pregnancy. I agreed to him referring me to the local stop smoking service, plus he suggested that I might find it easier to quit if my partner gave up smoking too. It was great to hear that we could fall pregnant quite quickly, and Mark advised me to start taking folic acid supplements straight away. It wasn't long before I fell pregnant with baby Jack, and remember seeing a great midwife, Anita. I told Anita how both Dan and my mum gave up smoking to make it easier for me. Anita was really pleased and congratulated me. She advised me that once the baby was born, Dan and I could be tempted to start smoking again, but it was really important not to, as smoking would affect our health, baby Jack's health, and any future pregnancies. She also repeated the advice Mark gave me about eating healthily and staying active to avoid gaining too much weight. We even discussed which form of contraception I'd like to use after the baby's born. I wasn't expecting that conversation, but it was really helpful, as it was one less thing to worry about after Jack arrived. Baby Jack is the best thing that's ever happened to me. But initially, I found being a new mum difficult and quite lonely. I constantly worried that I wasn't doing a good job. I felt a bit worthless at times. And whenever I felt low, I would comfort eat and crave cigarettes. I didn't feel like I could talk to anyone about how I was feeling and tried to deal with it on my own. This made things worse and caused problems in my relationship with Dan. My health visitor Kate was brilliant. She asked me how I was finding being a new mum, and when I told her how I felt, she reassured me that it was common. She said speaking to friends and family could help, especially Dan, and suggested I book an appointment to speak to my GP. Kate also gave me details of some local mum and baby groups and the number of a helpline. Kate visited recently and explained how important it is to look after both my physical and mental health, especially when it comes to having more children. She showed me an online tool from Tommy's that gives information and support based on things that are going on in my life. She also said it would be best to inform midwives in the future about how I felt after my first pregnancy. Thanks to Kate's support, over time I began to feel a lot better, and thankfully Dan and I got through what was a pretty tough time. I'm really grateful for all the help Mark, Anita and Kate gave me before, during and after my pregnancy. Their advice has made being healthy so much easier. And I'm so glad that I made these changes. I've been able to give Jack the best start in life, and even if I hadn't got pregnant so quickly, I feel better in myself for being fitter and healthier.